Nothing really revolutionary or new that's come out. Tarek seems like he's scrambling on something. What are you scrambling?
Sound, just sound.
Oh, just sound?
Just, sorry guys, one sec.
No sound?
Now there's sound. Now there's sound.
Well, hello again. I'm your host, double board certified reproductive endocrinology and infertility specialist, Dr. I.E. Victory. Welcome to Fertility Factor Fiction. And we don't have a great topic tonight. We did not have any great papers published recently. Nothing super interesting to look at. So we are going to take questions straight away. And hopefully we can have a nice chat about all the different topics. I do want to say one thing, which you could probably turn into a clip. So here's one of the clips I was going to make with you. So there's a lot of people right now worried that if you delay your fertility past the age of 40, let's say, for even 6 months, that you're not going to get a chance to get pregnant, that you will lose your chance to get pregnant, or it will compromise your outcome in some way. And there are actually fertility centers. I've directly spoken to patients who have interacted with them, who are actually telling patients, if you don't go for your IVF cycle right now, you're going to lose your chance and you won't have any time. And they're actually taking them from their consult to a financial consultation where someone kind of railroads them into IVF and gets them to pay as soon as possible so that they're investing a ton of money into this before even having a chance to process what's going on. So you're not even getting your results necessarily. Some places do, some places don't, but you're going from like here's what's wrong to you need IVF right away. So there's very good data from multiple studies, and one study in particular, I think it was out of Israel, which showed that there was absolutely no difference in outcomes if you waited from initial visit up to 90 days or waited up to 180 days. Zero difference in outcome. The live birth rate was the exact same. So never feel like you must rush into your next IVF cycle because of your age or your declining AMH. Yes, I support being expeditious, and I do want you to kind of hustle, but I also will never push you into IVF at any age because it's not something people should be pushed into. Make sure you're getting the right answers, and don't let anyone take you from a discussion to a sort of IVF financial consult just because they want to push you into an IVF cycle. We never even do them on the same day. We give people a chance. Like I'll meet people here who go, I want to do IVF, and I can tell maybe one of the partners isn't sure, and I'll tell them like, you've got all week, or you've got all month, or you've got the next 6 months. Like take your time, go home, think about it, come back and tell us when you have a comfortable decision. I can push people into it. Of course I can, but like, I don't want to do that. That's not realistic. That's not being a real doctor. That's just pushing business. And I will never do that. I'm not going to force anything on anybody. So make sure that whoever you're working with has your best interests at heart and has the best interests of your outcome at heart rather than any kind of financial interest. That's hugely important. That's what we're striving for. Dr. Zaneku and I are starting to work on some ethical guidelines for clinics to follow that will be mainly financially motivated. I mean, we all practice ethically, I hope, but the financial part of it has to be ethical as well. We shouldn't be jacking up prices on people suddenly or forcing them into treatments or railroading them into something before they even know what's going on. People should be offered options. They should be offered education. They should be offered opportunities for whatever they think best suits them and then go into treatment. And yes, many of them will need IVF. And if you need IVF, great. There's no reason not to do IVF. But no one should be forced into IVF. That's just wrong.
Heteropositive for factor V.
Okay.
Is induction always necessary? My local OB is suggesting stopping InnoHep and aspirin at 36 weeks gestation and seeing what happens. Also, should we back on blood?
Should we back on blood?
Mm-hmm. Back on blood.
Back or bank?
Back. Should I be back on blood? I disagree with that.
I don't understand the last part of that question, but if you are heterozygous for factor V Leiden and you've never had a clot before, you should only be on prophylactic dosing, which would be like 5,000 units of heparin or 5,000 of fragmin or, whatever. There's different substances, 40 of Lovenox, 3,500 of Inahep, whatever you want to use.
Back on blood thinners after birth.
Oh,
on,
yeah.
On Facebook,
Yeah.
they included something.
So I would not go off. I can only speak for my practice. I can't tell you what to do. You must speak to your own doctor. But I've never heard of that being done before because there's no risk from staying on the blood thinners. It doesn't cause more bleeding unless you're therapeutically dosed. If you're therapeutically dosed, that's a different story. But if you're only prophylactically dosed, there's no restrictions. Like you can get an epidural, you can get a spinal. It doesn't cause more bleeding. It's totally safe. So I don't know why they would do that. Now, granted, we do hold our heparin dose the night before an induction, and we do tend to induce our patients who are on thrombolytics, but I don't know. I don't think that makes sense. I certainly would not tell anybody to stop at 36 weeks. That's when you're at your highest risk of a clot. So that doesn't make any sense to me at all. But maybe your doctor has a reason I'm not aware of, and you need to talk to your doctor about it for sure.
I got some fertility golds here. This question's going to be
a doozy.
Mm-hmm. Yeah, I hope you're ready for this.
Does it have anything to do with the doula that we got kicked off?
No, not yet. Not yet. So far, doula friendly.
Can we just comment on that? I think we should. Okay, so I saw a doula that posted something that was absolutely not true. And so I went on there and I made a comment saying that it wasn't true. And then she went into this whole diatribe on how I wasn't a real doctor unless I knew how to deliver a vaginal breech, as though she knew how to do a vaginal breech. And then went on to all these tangents about how there were interventions. And I said, like, what are you talking about? You're a doula. Like, I respect doulas. I have friends that are doulas. They're great people, but stay in your lane. Your lane is to just facilitate comfort during labor. There is no medical training associated with becoming a doula. Zero. They have no authorization. They have no licensing body. There's no standardization. Zero. It's a 48-hour weekend course anybody can take and then charge more than we get paid to deliver the baby, which is a whole other story. And she was trying to tell me to stay in my lane because OBs were actually trained only to do surgery. OBs are trained to actually deliver babies from moms safely. That's our training. That's all our training. And it means we can handle the easy ones and we can handle the super complicated ones. And we can also handle it when it hits the fan and there's an all-out emergency. So I got kicked off because in her final statement to me, she said that I needed to understand that we had different lanes. And I said, no, we have one lane, safe delivery of babies and moms. And she couldn't handle the truth, so she banned me. So I kind of wear that as a badge. I kind of wear that as a badge of honor now. Like we should make a video with me. Like,
how many people?
yeah. Like if I'm getting banned from someone's posts because I'm trying to speak the truth, it just shows you how corrupt and dishonest they are. We've got tons of people on our posts for vitamin K that said all kinds of crazy stuff. And I only will ban people if they're being rude or they're just sort of swearing at people or insulting people. But if they're providing false content, how about it? I'm happy to keep going back and forth until you stop because I won't relent. That's just not in my nature. But I'm not going to ban you. But if I'm getting banned, I'm, to be honest, kind of quite proud of being banned. It tells me that like I'm doing the right thing. That means that I'm exposing lies and they can't handle it. So they got to get rid of you. So I'm okay with that.
I'm actually surprised she kicked you off.
I know.
I'm genuinely surprised.
I know the funniest thing was that you are still on. I guess she didn't realize you're with me. So yeah. At Emmy Robin Doula, right?
Yeah.
Who fully feels that she's medically qualified. And maybe she is. I mean, it just says doula, but I'm not aware of any doula organization anywhere in the world that qualifies you to provide people with medical advice or to oversee their home deliveries. You want to do a home delivery, get a midwife or get an OB to come to your home and deliver you. You want to have a physiologic birth? Great. Talk to your OB, do a physiologic birth. Talk to your midwife, do a physiologic birth. But doulas are not medically licensed tested, qualified to be providing any kind of medical care of any sort. Zero. So I lost my
I come
marbles.
on this show,
Yeah.
and I talk a lot of jazz, and I present myself as Dr. T. But push comes to shove, I'm not delivering anybody's baby.
Yeah.
I know my lane.
Nor would you ever
right
offer medical advice to
I
someone.
would not.
No.
I would not. I would tell my daughter or my wife what I think, but then I would always preface. I'm not really a doctor.
Yeah.
Right?
Yeah.
That's just the bare minimum you can do, I think.
It's called the Dunning-Kruger effect.
Oh, is that what it is?
Remember we had that post with what's that guy's name? John Cleese. So John Cleese, the comedian from Monty Python, has this great little clip that we put up on our Instagram. You should definitely check that post out, where he talks about this thing called the Dunning-Kruger effect, which was developed by a Cornell researcher. And it actually demonstrates, and I'm not trying to insult anybody, but you need to hear this. It demonstrates that many people are actually too dumb to realize that they're dumb. And they actually don't understand that what they're saying is nonsense because they're not capable of understanding that what they're saying is nonsense. And that's like everybody on social media now. Like they're all saying, oh, vitamin K and vaccines and, physiologic birth, and none of them know what the hell they're talking about. They're just making it up as they go. Just before I started the show, I was still texting some guy that was trying to tell me that their aluminum in vitamin K shots is harmful. There is no aluminum in vitamin K shots that's intentionally put there. What is in there is literally absorbed from the air. And when they measured it, it was 1/20th of what's in an actual breast milk supply for one day. So this guy's trying to educate me, telling me he will talk to me when I'm ready to listen and telling me that he's going to teach me about the disadvantages and risks of being exposed to aluminum when he doesn't even understand what he's talking about. And that's who we're dealing with these days. So you guys all have to be so careful. And I have to be passionate about this and say, this is why we love doing the show. You need to be so careful about who you listen to out there because there's so much misinformation. You've got people telling you physiologic birth is better. Physiologic birth is not better. You've got people telling you OBs intervene too much. Maybe some OBs do. Not all of us do. And certainly it's not like a pattern in Canada. So you need to be very, very careful about who you're listening to. If you're going to start listening to someone that's offering you medical advice, make sure you're actually looking for the qualifications of that person. What was the name of that guy you were telling me about? He was talking about vaccines and he was talking to those women. Mick something. Peter McCullough.
He's a legend online. Beware.
So Peter McCullough references this group in one of his talks where he says it's an international group. Okay, so I was like, hey, maybe these people know something I don't. So I went and looked at the international group he's referencing. So the only actual doctor had his license revoked for spreading misinformation, number one. And then everybody else is a non-physician. And then they're in their actual mission statement. It says that they don't trust anything that comes from pharmacy. And they believe that the body has the power to heal everything and all this crazy stuff. It was ridiculous. And that's who this guy references. And he calls it a global organization. It's a global organization of fakes. How are people just eating this up? I don't get it.
That's what happens from COVID. People got so, disenchanted with medicine and doctors that now they're like, hey, well, you know what? If you're not a doctor, you must know what you're talking about. Because my doctor didn't understand anything about COVID, so therefore all doctors know nothing about everything. And now anybody on TikTok, literally anybody,
is better.
Is better.
It's completely unhinged. The animals have taken over the zoo. Yeah. It's terrifying.
Yeah,
it's
the animals have taken over.
The animals have taken over the zoo.
The animals have taken over the zoo.
Yeah. All right. Nice question.
All right.
This is the big one. You were building up.
I was building up for this. That's right. Hey, Dr. V, I know you're not a fan of estrogen priming.
Yeah.
But listen to this. This is going to make you go.
Okay.
But my clinic insists on it.
Oh.
But we're not done yet. They insist on it, and they're giving me choices.
Okay.
Between patches and pills, which one is less bad in your opinion? Thank you.
The patches would be less bad because you're missing the first pass effect of going through the liver, which is known to cause more inflammation. But there are 2 randomized controlled trials showing no benefit and possibly a disadvantage. So why would anybody be insisting on it? And no clinic has the right to insist on a protocol. It's your money. It's your protocol. You get to direct your healthcare. Nobody can force you into treatment. Like, that's not even legal. It's actually
But that's why doctors have this thing. See, this is another example. When people are like, well, the doctor's telling me I got to do it, therefore I got to do it. And that's why you have all these crazy people now just like making bank, I think, on the internet, giving false medical advice because people are feeling
that doula that banned us? Emmy Robin doula, okay, just to go back to that.
She's the conversation piece.
She was selling a book.
That's it.
She was selling an ebook to people, right? And that's the whole thing. All these people are trying to sell something, protein powder, some nutritional supplement.
And I bet you all of it's made in China someplace with God knows what's actually going inside of it.
I mean, it's ridiculous. Even if they're trying to sell a book, okay, and there's fertility specialists out there that have books. You and I have talked about doing a book. I'm all for it, right? But
I would read your book.
Don't be getting online, spreading lies and then profiting from it. That's just horrible. And it's all sensationalistic stuff, right?
It's always like
physiologic birth is better and you got to do it this way. And the doctors are trying to harm you and your baby. And that's why your child's autistic because you got oxytocin. Oh, for God's sakes.
That is what it's become. It's absolutely become
just that. And then it's here, buy my book and learn the truth.
Yeah. Yeah, that's right.
How about we
buy my book?
How about we not buy her book and give the money to charity where it'll do much more good?
Or you could just come on the show and ask you.
Come on the show and ask.
We're literally right here.
The best part is anytime you try and disprove someone, they immediately it's total propaganda, playbook. The first thing, they lie. Then when they lie and they don't get what they want, then they say, oh, well, if you challenge them, they go, well, no, that can't be true. And then you provide evidence and they go, you're working for Big Pharma.
Yeah,
I'm I'm Canadian. I don't work for Big Pharma. And then when you say you don't work for Big Pharma, then they just insult you personally.
Yeah.
You look like a monkey or you act like a monkey, whatever.
You can't win with these guys.
It's ridiculous.
Facts don't mean anything.
Gone.
Yeah, facts are gone.
Reality's
subjective reality.
I love that. Subjective reality. That's what it is. Yeah. There is no more. There's no more real. We live in the Matrix.
Everybody took the
what
pill is it? The red pill?
I don't know. You need the green screen to go.
Put the green screen in the after. In post production, there's gonna be a green screen here.
Yeah.
You're gonna wear glasses from here on in. Black glasses. You're Morpheus.
Yeah.
Hi, doctors. Again, we'll accept that.
You'll like that.
Yeah, I like that, obviously. What is your wait time to see you? I got 0 wait time, to be honest. I'm turning 38 in August. I've had 3 miscarriages, and I've already seen 2 fertility doctors who were absolutely incompetent.
Oh.
And I'm not exaggerating.
Oh.
Part 2, she continues to say, first doctor said, I'm not ovulating without doing any cycle monitoring. Second doctor said that the test for anticoagulants is negative when it was actually positive. Oh.
Ouch.
Bring me your papers. I'll take a look at it. I'll be better than both those guys combined.
Just DM me and I'll see what I can do. I'm really sorry you're having a hard time. And I sincerely apologize on behalf of whoever those colleagues are that failed you. I'm really sorry. That's terrible. As a fertility specialist, my job is to help my patients and all patients. And I do. And I take that job very, very seriously. I think you all know that. But part of my job is to help with my profession as well. And so when others are not doing a good enough job, you do have my heartfelt apologies, because we as a profession, me as a member of a group, we need to do better. That's why I have a very small group of other doctors that I trust and that I like. And so, yeah, I mean, I'm sorry that you're going through that, but reach out to me. Just DM me and we'll talk.
Hey, Dr. V and T. Oh, actually, sorry. I read that completely wrong. Hi, Dr. T and V.
Oh,
Had to correct that. That's an enormous error. What ferritin level would you start iron supplements? Would you delay starting iron if ferritin is borderline until after IVF due to the pro-inflammatory effects of iron?
Iron in the right concentration is not pro-inflammatory. So you want your iron level to be adequate before you start an IVF cycle in order to use its strong ability to bind up a lot of junk in your body. So you need iron there.
What does it mean if there's fluid in the uterus after suppressing for 2 months with Lupron and letrozole? What can cause this fluid, and can suppression have anything to do with this?
Usually it's not from suppression. So your microbiome could be altered. You could have an isthmusal hydrosalpinx. Those would be the top three reasons for it, or cervical stenosis. That's quite significant. So tight cervix, that's a possibility. Isthmusal would be number one. Fallopian tube infection with hydrosalpinges, which is fluid-filled sacs, or that you have a microbiome disturbance like an infection in your uterus or an imbalance of bacteria in the uterus. Any of those are possibilities.
Dr. Victory, this question is for you.
Okay.
Meaning they didn't mention me whatsoever.
Oh,
yeah.
But you're being a gentleman about it. And that says a lot about you. Yeah.
No, I know. I don't just pick the ones that say Dr. T. I believe everyone deserves a chance.
There you go.
Fertility questions.
Everyone deserves a FFOF question.
Yeah, why not? So we're going to start with this one. This will be the exception to the rule.
Okay.
After that, I'm not answering anybody that doesn't address me. Morning, Dr. Reed. What do you recommend for a cervix measuring at 28 millimeters at 13 weeks? I'm already on progesterone, but the OB is saying to just monitor.
28 millimeters is normal. We don't get nervous until it's less than 2.5, so I wouldn't do anything differently either. I would monitor, but in my patient population, I wouldn't do anything differently either. Talk to your OB, but I would probably agree with them.
Hello, doctors. See, love has returned to the world. What could cause false weak positive for lupus anticoagulant? When I took the test was right after a miscarriage, and I think I was also fighting an infection, I think.
Yeah, infection can do it. Any kind of inflammation in the body can do it. A recent miscarriage, your prothrombotic factors go up, so that could do it as well. So yeah, anything like that could have altered it. Just wait and recheck.
Hello, Dr. V. I have stage 4 endo and Asherman syndrome and struggle with thin lining. Do you still recommend down regulation? I've also had a cystic fluid collection in my lining, which keeps coming back.
Wow. Very difficult case. I would need to meet you and speak with you, but those are cases where we would often talk to you about using a surrogate. The stage 4 endo takes a huge toll. The fluid in your uterus can be difficult to manage. For the stage 4 endo, you would need suppression, but then the suppression will thin out your lining, and then you're inevitably going to need estrogen. That's a lot. It's a very complicated case. I would have to talk to you and see about playing with non-hormonal therapies to thicken your lining. L-carnitine, L-arginine, PRP, Neupogen, HGH, like all the things we can use that are non-estrogen based to thicken your lining. And then if that didn't work, I'd be having a long, detailed chat with you about whether or not it's going to work at all, or should you consider a surrogate.
If you have DOR, is there still hope to get pregnant naturally with low egg count?
There is always hope. So one of the things people need to understand is that AMH is not a predictor of pregnancy. AMH is a rough marker of the number of eggs your body is capable of producing. It does not predict pregnancy, IVF outcome, IUI outcome, or anything of the sort. So you can absolutely get pregnant naturally with diminished ovarian reserve. It's just a matter of what else is going on. Are you DOR because of endo? Do you have adenomyosis? Did you get chemotherapy? What's your partner's sperm like? There's all sorts of different questions to be answered, but DOR in and of itself does not preclude pregnancy. It just makes it harder. And you definitely will have fewer pregnancies, but it's not going to tell you yes or no on the incident pregnancy you're trying to achieve.
100% fertilization, but only one blast.
Yeah.
What could the issue be if sperm and egg quality look good to the embryologist?
Yeah, I know that case because it's something that was brought to my attention. So um, it could still be unknown impact of the sperm or the egg. So, for example, guys will have sperm aneuploidy. That means the genetics in the sperm are abnormal. We won't know that. You could have functional changes in the eggs that we wouldn't know about. So those are possibilities. Clearly, if the fertilization is 100%, the lab part of things has done well. So it's not a lab issue, but it's got to be a sperm or an egg issue. And why and how, we don't always know.
Hello, doctors. I have an inherited thrombophilia and a miscarriage of normal embryos at 10 weeks. Thoughts on heparin and steroid shots, please.
Well, if it's just the thrombophilia, heparin alone should suffice. We would give you aspirin and heparin, but you don't need steroids for an inherited thrombophilia. There's no benefit to that. So we would just use the heparin. In fact, heparin and aspirin and steroids can cause a stomach ulcer, so you got to be more careful.
Stomach and medicine, sensitive thing. Got to be careful.
Very much so. Yeah.
Very much so. Yeah. Doctors, my clinic doesn't run melatonin. I read these sometimes and I say to myself, why? What are you talking about? Doctors,
Yeah.
listen, you judge if I'm off.
Okay.
My clinic doesn't recommend melatonin. If you're on thyroid meds, what do you think? Same for LA and NAC. I read they raise TSH.
So I haven't seen that data. People have been commenting on that. I haven't actually seen it myself yet. But I mean, we keep close track of our patients' TSH levels. So the worst comes to worst, you just need to give them more thyroid supplements. Who cares? That's an easy thing to do. Why would they not recommend melatonin? I don't know. That to me seems ignorance of the data. It's very clear that melatonin is beneficial.
See, I'm not wrong. Melatonin is very.
You knew it.
I knew it. I knew. Yeah. Once I read it, I'm like, oh god.
That was one of our earliest shows. Like
early show melatonin.
It was. It was like a really early, probably like within the first year that
we're technically way ahead of almost everything that people are saying today.
We are very much ahead of everything.
Way ahead. Yeah. Way ahead. Yeah. We're before the trends.
We are.
We're way before the trends.
Yeah, for sure.
Talented T. Well, hey, talented you. Help. No problem. We'll help you. Clinic wants to trigger me for fear of estrogen plateau.
Oh, I talked to her today.
What is this? I'm on CD9 of stims. Yeah. E2 was 428 yesterday and 680 today. Can I lead a follicle negative affect others?
No. Not when you're on an antagonist or agonist protocol and you're getting gonadotropin stimulation. So all of these follicles have receptors on them. And as long as you're saturating the receptors with FSH, they're going to grow. The lead follicle in a normal circumstance sends back a signal to stop all the other follicles from soaking up the FSH. But you're not going to do that when there's an abundance of FSH there because you're taking FSH. So no, anybody telling you that is out to lunch.
T-Man.
T-Man.
They're calling me out. It's like, hey, T-Man. I'm right here, guys. Yeah, I got you. One more question.
Okay.
Dr. V.
Yeah.
Do you let an egg mature overnight if necessary and still perform ICSI the next day? Is that even possible?
Yeah, so we do. It's called in vitro maturation, but it doesn't work well when you do it in that circumstance. So if you took an HCG trigger or grew the eggs, I should say, if you tried taking the stimulation first and grew the eggs, and then you trigger and you do your retrieval and you get M1s or GVs or whatever, and you try and mature them, it really doesn't work very well. IVM, which we're about to start, does work very, very well when you use it in the circumstance where you're retrieving the eggs, in our case, with zero medication. We're going to be doing that very soon, but it does not work well when you administer meds and then you retrieve the eggs. The outcomes from that are less than 10%. So we do it universally. We try it all the time. It's really kind of meh. I don't think we're getting a lot of pregnancies from it for sure.
From New Zealand.
New Zealand.
New Zealand.
You know what? New Zealand was kind of fun. I didn't get to tour around very much. Lisa went and saw Hobbiton, but I didn't get to go. I basically walked downtown, saw some shops, went back to the hotel, and never left again. Yeah.
It's a big flight. It takes a long time.
Yeah.
Yeah, that takes a long time.
Yeah.
Hi.
Something shut off.
Yeah, you're the camera guy for a couple seconds.
Okay.
Hi, I'm from New Zealand, and I'm going to start IVF soon.
Okay.
Any advice?
Blank
slate.
Yeah, vitamin. So thank you for watching all the way from New Zealand. I was in Auckland last year. So yeah, you want to make sure that you are taking lots of vitamins, lots of supplements. Make sure your weight is controlled. You don't want to have a high BMI. It compromises egg quality and outcomes. Make sure your partner is not smoking, drinking, or using drugs. Same for you as well, of course. Have lots of sex. That's beneficial. Make sure he's taking vitamins and supplements as well. Try and keep your stress levels as low as possible. Yoga has been proven to be beneficial, so that can be helpful as well. So yeah, those are the basics. Those are all the things we would generally recommend. Make sure you're with a really great specialist. The feedback from the clients I met in New Zealand was not strongly positive about the care they were receiving. It seemed very cookie cutter. I won't mention any specific clinics, of course, because I don't know everybody's care was the same, but the feedback was it's very much just, this is what we do. This is how we do it. If you don't like it, get out. So
I would suggest, and of course I am not a doctor, but I would preface, be aware of the information, ask tons of questions, and when confused, join us Tuesday at 8 p.m. and you can get a little bit of clarity.
Yeah. All good points.
Yeah, see? And I'm not a doctor.
And you're not a doctor. But you have learned a lot being here.
I have learned a ton.
It's hard not to, right?
I'm confident I could diagnose a lot of things going on over here. Dr. Victory, I recently had a DNC, and a local OB and ER doctor were adamant that retained tissue is not possible after the procedure, even though my ultrasound indicated retained tissue with a blood supply still. I was given 2 doses of miso, but no changes. Is this accurate that retained tissue is not possible when having a DNC procedure? Thank you.
With all due respect to whoever told you that, they are categorically incorrect. 1% of all DNC procedures will fail, resulting in retained tissue. That's a standard that we tell everybody about, because you have to advise people when the risk of an outcome is actually 1% or higher. So we have to tell everybody it's got a 99% success. 1% will have retained tissue requiring more. So whoever said that definitely was either not communicating well or unaware. But yeah, you can absolutely have retained tissue after a DNC. Yeah.
I think this individual is just taking advantage of the fact that they found a doctor on YouTube taking questions live. Maybe you know it, maybe you don't.
Okay.
What is the first order of business? I like the question phrase. With hemorrhoid treatment. Don't know if it's a joke or if it's real, but what the hell?
Avoid constipation. Don't strain. Those would be 2 big ones. Eat a very high fiber, high fluid diet. And then there are therapies that can be used. There's medical first, which involves a bunch of different chemicals. We often use proctocetyl for our patients that have hemorrhoids in pregnancy. I'm not promoting proctocetyl by any means. That's just what we use. And then there's surgical options, not in pregnancy, but for non-pregnant patients.
We're going to go to TikTok. We're going to do a whole bunch from TikTok right now, because once I move my cursor, it just goes. So let's bear with me here.
Okay.
If you have a DOR, is there still hope to get? Oh yeah, we did that one. Okay, good. 2 failed FETs with a genetically normal embryos. Hysteroscopy was fine. Next steps.
I'd still want to know what the shape of your uterus looked like, so I'd need pictures of your hysteroscopy. I need to know your partner's sperm DNA fragmentation, your body mass index, social habits, smoking, drinking, drug use. I need to know whether or not there's a microbiome problem. I would want to know if there's an immune problem. I would look at thrombophilia, and I would check your vitamins and your hormones very, very carefully, including a full thyroid panel. So that's where we would start.
For PAI-1, is it better to be on Frag 2500 or Frag 5000? Or is it even needed?
Pi is controversial, but if you are going to do something, it's Frag 5000, not 2500.
Oof. That's what happens here. All right. I tried to go to scroll and now I lost this one. I told you I shouldn't move anything. Thoughts on Metformin for someone without PCOS but has endo?
Yeah, we talked about that a few weeks back on the show, maybe 2 months ago, actually. So metformin does have benefits for endo patients, specifically through physiologic pathways that it follows, some of which are involved with VEGF. So yeah, I would definitely recommend it. We are integrating it slowly into our endo protocol. It's not for everybody though, because it does cause a huge amount of stomach upset. I don't know how well that's going to work. Yeah. But we are allowing people to use it, recommending it in some cases.
Do fibroids cause miscarriage?
Definitely. Fibroids are proven to cause miscarriage, especially if they are submucosal, meaning a portion of them is pressing into the inside of the cavity. It's a 100% increase in risk of miscarriage, 50% decrease in chance of success. So, yeah, no question. That's from a Elizabeth Pritt's article in Fertility and Sterility. I forget when the last revision of it was. I want to say like 2016 or something, but it's in there. You can see it there.
I got a big one for you. You ready? Write this down in your mind.
Okay.
Hi, Dr. VNT. I'm 34 years old. First IUI in early 2023 led to a chemical pregnancy.
Okay.
First IVF later in 2023 had 23 oocytes picked,
Okay.
10 fertilized, only 3 blasts, and did PGT-A. Finally had two.
Okay.
FT was successful, got pregnant, but I had contractions like pain in 18 weeks, had to undergo 2 emergency cerclage, had a miscarriage at 19 weeks, 19W at 5, high uterine swab just before miscarriage, and later placenta swab and culture confirmed E. coli, ESBL present. I still have 1 frozen embryo. What would be your advice for next steps?
Oh, 100%. Your microbiome is off. So you need Fertility or some type of microbiome test. I don't use Emma Alice, but get some kind of microbiome test that's extensive and will tell you what bacteria you have. Do not go forward, in my opinion, until you have solved your microbiome problem and checked to confirm that the antibiotics that you took worked. That's a microbiome problem through and through, no question.
Dr. Victory, I am 8 weeks, 4 days pregnant with a day 5 embryo transfer.
Okay.
I started spotting yesterday, had a transvag US, no SCH, but advised it is likely due to the progesterone vaginal suppositories. That's it.
No. Yeah, that makes no sense. Progesterone suppositories don't cause bleeding unless you scraped your cervix with the applicator. That doesn't make sense to me at all. Yeah. We would recommend ALA. So you have to talk to your doctor, but alpha lipoic acid is a supplement that's been shown to be beneficial for patients with bleeds, including in randomized controlled trials. And then obviously make sure that you're getting your RH status checked and that if you need to get ROGAM. So those are all things you need to consider.
Why are IUIs done the day of ovulation instead of 12 to 24 hours ahead of ovulation? Wouldn't the procedure be more effective if the sperm were already waiting for the egg in the fallopian on ovulation day?
That's a great question. So first of all, let's go through the physiology of this. The sperm is actually in the fallopian tube within minutes of the time that it's ejaculated. So it doesn't take long in a natural circumstance to get there. And then from there, it's just spilling out the tube in theory. It's not like they get into the fallopian tube and they're like, okay, everybody stop moving. We're not going to go anywhere anymore. It's ending up in the pelvis. So you need to be kind of thinking about it clearly in terms of how the actual natural physiologic process works. So that's number one. Number two, they have actually studied the difference between 24, 36, and 48 hours. And there's absolutely zero difference between those. So 48 has a lower chance, but 24 and 36, there's no difference in outcomes. The final thing is, while 24 hours after trigger would make sense if you triggered someone at 9 in the morning or something, and then you brought them in the next day at 9 to do an IUI, or 10 or 11 or 12 or whatever, that makes sense. 12 hours is a real problem because the 12-hour timing would not make sense at all, because just the way it would work for us for when we would have to bring you in, it'd be the middle of the night every single time, or you'd be triggering in the middle of the night every single time. So we desperately try to avoid that. Sometimes you have to, you don't have a choice, but that's not like ergonomically a good idea.
Hi, doctors. Can endometriosis cause high baseline estrogen levels on its own? I am told I don't have a cyst, but I have endometriosis. Why else would my baseline estrogen be high, AMH 1.8 nanograms per mil?
You could have a cyst. There are some women that are higher in their estrogen with endometriosis because they'll have receptor abnormalities. So I would be looking for a receptor problem in you. That would be a complicated case for sure.
Last embryo. There's more to it. Yeah, I'm just giving you the dramatic.
I was like, whoa. Yeah.
Protocol includes prednisone. Thoughts on adding Claritin and Pepsid? Last embryo warning.
Yeah. So you're probably with a 3-letter clinic in the US that we all know. Yeah, there is zero, and I do mean zero evidence for the use of Claritin and Pepsid in any kind of fertility treatment. We are actually conducting a randomized controlled trial of a proton pump inhibitor at the time of embryo transfer, but it's for a different reason. They're looking at it from a histamine release perspective. We're looking at it from a uterine contractility perspective. They're totally different. And there is no evidence. I looked it up. There's nothing on Claritin. There's nothing on Pepsid. Zero. It just doesn't exist. There's no evidence for the use. You know that lady that I said contact me?
Yeah.
She already contacted me.
Here we go. She's ready.
Yeah.
Hello. No doctor, no Dr. V, no Dr. T, just straight up hi.
That's okay. You know what?
We'll do it.
Everyone's different.
You want me to keep breathing?
Yeah.
I was thinking of not.
No, just let it go.
Thank you for doing this. Well, at least there you go. 2 questions.
Oh, 2. Okay.
2 questions and not even a hi, Dr. V. Just 2 questions. Can anything change egg quality at 42? And how long between TTC and Mounjaro?
6 to 8 weeks between TTC and Mounjaro. Can anything change egg quality? Sure. Vitamins, supplements, weight loss, avoidance of toxins, endocrine disruptors, making sure that you're taking a healthy diet, yoga, all of that stuff can have a difference. Some people talk about red light therapy. There's some really weak evidence for that, but maybe. So there are a lot of health conscious decisions you can make. Probably the biggest ones are no smoking, drinking, drug use, eating a healthy anti-inflammatory diet. Like on our posts from Endo Nutrition Dietitian.
Mm-hmm. Yeah. Right.
Endo Fertility Nutrition Dietitian.
I'm gonna read this question.
Yeah, you were grinning. I could see.
Yeah, because I'm actually curious if this is even a thing. Like I myself, the questionnaire
that always makes me nervous because the few times where you and I were confused, it was always something
but you might
bizarrely sexual that we had never heard of.
Is it that time? It is that time. You're not wrong. But
fertility after dark.
Yeah, fertility after dark. Yeah. Hi, Dr. V. My husband and I have been TTC for 1 year now.
Okay.
And I went to a naturopath, and she told me it's because of inflammation and that my metabolic age is 90. I'm 30, eat well, sleep great, exercise. Yeah, that's about it.
That's it.
If I'm not mistaken, that's it.
Yeah, I mean, I have a hard time believing that. So maybe see a second opinion from the naturopath. Like if you're eating well, you work out, you're healthy, you have no bad habits, how could your metabolic age be 90, which is not good for sure. So
That's
that
what I
doesn't make
understood.
sense.
When I read that 90, I'm like, how do we even give this
Yeah.
number?
Yeah, that doesn't make any sense to me at all. So yeah, no, don't do that.
Yeah, that was my personal opinion as well. Hey, doctors. Oh, sorry. Do I need to be on Lupron and letrozole first before an egg retrieval?
Definitely not before an egg retrieval, unless you're trying for a fresh transfer. But even then, I wouldn't do that. The suppression's too strong, and if you have endo, you're already going to have weaker ovaries. So no, I would not do that before a retrieval. Before embryo transfer, we recommend it for our endo-adeno patients, but never before retrieval. In fact, Lupron before retrieval has been proven to be detrimental. So definitely don't do that.
3-part question from TikTok.
3. Do I need a pen?
No,
All
they
right.
just didn't. I don't think TikTok lets you write enough.
Okay.
Thoughts on endometrial scratch as part of a protocol? If you've already answered this, my apologies.
Let me do one at a time.
All right. That's one part?
Yeah.
Okay.
That's the most controversial topic in all of infertility. The current overall suggestion is that it's useless. Every couple of months, somebody publishes a new article saying, no, it's the greatest thing ever. And then the next month, somebody publishes one saying it isn't. But overall, we don't think it really works. And it's painful and it sucks. And you could potentially be influencing bacterial colonies in there. I don't think I've done a scratch for fertility, like cancer searching biopsy. God, it's got to be at least 12 years or something like it's been a very long time, a very, very long time. Yeah.
Continuation. 40 years old. AFC is 19.
Oh,
AMH is 0.7. And had my first retrieval with 18 follicles, which ended in 2 eggs. Doctor said I have LUFS, but later said I had ovulated the entire left side early. Sounds like a timing issue with HCG trigger and not necessarily LUFS.
Yeah, okay. Yeah. So first of all, I don't believe in empty follicle syndrome or LUFS or anything like that. I think that's all nonsense and excuses that doctors made up to explain the fact that they didn't get out the egg. So it is extremely, extremely rare that we will not get a follicle if we flush the follicle out. So if you get 2 or 3 eggs and you're not getting anything, you got to start flushing. Now, if you ovulated, that's a totally different story. And then I would want to know why you ovulated early. You need to look at your stim sheet, look at your LH levels. Did you spike before they gave you your HCG dose? In which case, nothing's going to stop you and it's impossible to deal with that situation. You just cancel the retrieval and you start from scratch. But aside from that, we don't see that very often. So at least here, I'm saying VRC doesn't see that very often. So I'm not worried about that outcome as a general rule.
What supplements for transfer after suppression for endo, I guess, do you recommend?
NAC, curcumin, resveratrol, ALA, coenzyme Q10, prenatal vitamin, melatonin, fish oils, and vitamin D.
If you find out that you have endometritis, should your male partner be treated with antibiotics as well?
1,000,000,000% yes, unless you're kicking him out forever. Yes, you have to, right? Because otherwise you're just passing it back and forth to each other. That doesn't make any sense at all.
Hello, doctor. I just had my egg retrieval 5 days ago, and number of embryos frozen today is 12.
Woo!
Is it good?
I think we all know the answer to that. Yes, that's incredible. I mean, most people would kill to have 12 embryos. So that's incredible. Yeah, congrats.
Also, what is your suggestion for successful transfer?
Well, I need to know more about you. I mean, the general rules, eat healthy, exercise, stay away from bad substances, take all your vitamins and supplements. But I, I need to know everything about you to help you figure out what the best transfer protocol is. Some people need a lot more testing because of their history. Some people should be evaluated for endo. Some people need a detailed look at their uterus. I wouldn't know just from that kind of question. I need all the details.
T-Man.
T-Man, that's you again. Yeah.
One more cue, Dr. V. Do you let an egg mature overnight if necessary?
We did that one.
Oh, we did that one?
Yeah.
I just like reading T-Man. Hey, doctors, what would cause a false weak positive for loop?
We did
that one as well. All right, scrolling somehow. Hello, Doc. I have had 2 natural pregnancies, and now I have been trying, and Dr. Rahal told me that I am not ovulating and I should go for IUI, and why not ovulation induction?
I'm confused by that question.
Should I read it again? Or is just confused?
No, it just didn't make sense.
Okay.
So maybe she's just saying, should I go for ovulation induction without IUI? Ovulation induction is only useful for people that don't ovulate naturally. If you already are ovulating naturally, but you're not getting pregnant, just using Clomid is useless. It doesn't help anything. So you need to do Clomid with IUI to get a benefit, or letrozole with IUI, or shots with IUI. Maybe that's what she meant. I'm not sure. I'm not sure I understand that question.
Hey, Dr. T and V. Any updates on IVM being offered at VRC?
It should be ready basically any minute now. So we're just waiting for the nurses and the lab to be educated on it. Dr. Khosravi is supposed to do that. So if she's watching, can you please let me know when we're going to be doing that?
Hello, Doc. I've had 2 natural pregnancies, and now I've been trying. Oh, why no IUI? And then she followed up with another question. Also, why no kids allowed at your clinic?
Why are no kids allowed at my clinic? I mean, the odd time people will have to bring in their babies because they don't have a choice, but this is a fertility center. So bringing babies into the fertility center is heartbreaking for a lot of the parents and patients that have not been able to achieve that success or are having miscarriages or whatever the case is. So just out of respect for the ones that are suffering, we try and minimize that.
Hello. Is it possible for Ozempic to cause bleeding that looks similar to pre-implantation bleeding around 10 DPO? Since I've been on Ozempic on February, I've had this for 2 of my cycles.
Never read anything about that, so I wouldn't know because there's no evidence that I'm aware of relating Ozempic to menstrual cyclicity or bleeding in pregnancy. And you're not supposed to be on Ozempic if you're pregnant. So I would definitely talk to your doctor.
Hi, Dr. B and Dr. T. All of our embryos were fragmented and grew slowly and ended up arresting.
Yeah.
Will this fragmentation be the case every cycle, or can it vary cycle to cycle? Thank you both for what you do. You're very welcome.
Yeah, you're very welcome. Thank you for saying thank you. Yeah, it would depend very much on what was wrong. So ask your embryologist for a detailed review of your cycle. And this is something that I think other centers fail to do a lot. The doctors don't actually sit down and read what happened in the previous cycle to the patients. They just go, it didn't work. And then they say, do it again. So we actually go through like, here's how many eggs you got. Here's how many were mature. Here's how many were close to mature. Here's how many were germinal vesicles. Here's how many were empty zona or abnormal. Here's what the sperm looked like. Here's what the egg quality looked like. Here's how many fertilized. Here's how they developed. We go through it step by step so you're aware of what happened in your cycle. If you're not aware of what happened in your cycle, how can you possibly make an informed decision about the next step? So spend the time to understand what went wrong. Was it bad sperm quality? Was it bad egg quality? Was it both? Is there a way to improve it? And then figure it out from there. And yes, I'll give you a simple example. If they gave you super high doses of medication, it can fry the eggs, and that's terrible. if they did it for too long. I know one clinic that does stims for 20 days, 25 days. Like, that's just egregious, right? We know the egg quality is going to be crap. So, if it was too short, too long, too high a dose, all of those things can contribute. I reviewed a case once where the patient had been on a absolutely contraindicated medication, and they had done an IVF cycle on her. Like, you can't be on contraindicated meds and do an IVF cycle. So things like that can really make a big difference.
Hello, Dr. V. How would you know if I need heparin or Lovenox or aspirin? What tests are needed to be done? Thank you.
Thrombophilia screen. So factor V Leiden, protein S, protein C, prothrombin gene mutation G2021A, antithrombin 3 deficiency, methyl tetrahydrofolate reductase. Some people add in the pi. So yeah, there's a bunch of different things that we look at.
How many doctors work at the Windsor Clinic? If you're away during my cycle, how does it work for my care? And would you be reachable if there's a problem?
I'm always reachable. There are currently 3 doctors with privileges here besides myself, one that's here full time, another one that comes in on weekends to cover so that the 2 of us are not working incessantly, and one more that's available should we need him.
Dr. V.
Actually, 2 more. I take that back. We now have another one too.
Can you use birth control for mild adeno suppression instead of Lupron?
Not to the best of my knowledge. I'm not aware of any studies that show that birth control for adeno is beneficial prior to an FET. If anybody has read that, I'd be interested in looking at it because I don't believe it would work, but I'm not aware of anything that says that.
It's me again. That's how the question starts. It's me again.
It's me again.
I have O negative blood type.
Yes.
Would this be the reason for miscarriages at 6 weeks mark? Do I need a
No.
Rogan shot earlier?
No.
Does my husband's blood type make a difference in the fertility? Maybe.
Blood type has nothing to do with fertility as far as we know. And your baby is not producing red blood cells that early. In fact, now the current recommendation is you don't need to do ROGAM until you're 12 weeks. So no, that has nothing to do with it.
Continuing on with the questions.
Okay, 8:59.
Yeah. All my sisters had preeclampsia during pregnancies. Does that mean I will too? And how can I lose healthy weight during pregnancy? And is Creon 8% more or less than more or less than 400 milligrams of progesterone?
Crinone's roughly equivalent to about 300, if I remember it correctly, of prometrium. Will you have preeclampsia? There's no way to know. That's a crystal ball question. I mean, I would be worried, and I would recommend strategies to reduce preeclampsia to you if you were with us. And then the last part was, how do you lose healthy weight during pregnancy? Exercise and diet like you would outside of pregnancy. If you are overweight, your baby will get everything it wants out of you, so you don't need to worry about that.
That's TikTok trying to tell us, hey, are you a human?
Yeah.
And the answer is yes. Yes, we are.
Game's over.
One more question for the men.
Tarek's terminal question. All right. Yeah. For the guys. For the guys. We need more guys on the show. It'd be more fun.
Guys think they're invincible. That's why. They think that it's never their problem. Hi, doctors.
Okay.
Does red light therapy on testicles increase male fertility?
Supposedly it might.
Are you just going to leave it like that?
There are studies. I don't know that I believe them, but there are studies that suggest that it works. Yeah.
Well, that was a terminal question that you answered in 2 seconds. So
you want to do another one?
I guess. I was hoping for a little bit more than that. All right. Here's a doozy. Do you ever do immune meds for a retrieval if someone has antibodies that may impact blast formation?
Yes, but you got to be really careful with immunosuppression around the time of a retrieval, because that is a highly sensitive, non-sterile procedure that could easily result in a life-threatening infection if you're on immune suppression. So that's not an easy situation. You got to be super careful, and we normally send those patients home on weeks of antibiotics afterwards to be careful. Not to mention IV while they're with us. Wrap it up.
Wrap it up. Does that mean one more, or does that mean we're done?
No, I think we're done.
All right, well, guys, we're done. Doctor,
I got no sleep
wrap it
last night. Okay, so thank you for watching Fertility Fact or Fiction. I am off to Berlin, and I will be back for next week's show, where hopefully we will have something exciting to share with you. And then we can chat about new things and new questions. Hopefully there will be some new studies out by then as well, and we should have information on doing our whole new protocol with IVM. So I wish you all a very successful journey. I wish you all a very good night. Please, for the love of God, if you're watching the show, anybody you know that's being duped by people with no education in medicine or being misled or being misinformed, educate them. Tell them to stop following these internet quacks that think they're doctors, or even medical professionals when they're not. So be careful out there, guys, because there's a lot of people trying to take advantage of you. I, for my part, ask nothing of any of you. You don't need to come to us. We don't force anyone to come to us. The show is for free. The advice is for free. We don't have any sponsors for the show. Nothing. I just want to help people. So we're not asking you for anything, but all these people are trying to sell their narrative or some sort of supply of something or themselves. Yeah, just don't be part of that. Don't fall prey. Don't be sheep.
don't be sheep.
Yeah. We need a t-shirt that says
Don't be sheep.
Don't be sheep. All right, guys, have a good night, and we'll see you next week on Fertility.